I'm Leanne Aitken and I'm Professor of Critical Care Nursing at Griffith University and Princess Alexandra Hospital. I became interested in research really through a combination of factors. I'd been a critical care clinician for many years, and during my practice I noticed that patients survived to get out of intensive care, but then had lots of challenges with the recovery after intensive care. At the same time, intensive care was becoming an environment where we did a lot of research, and so the two of those factors naturally melded together to lead to an interest in trying to improve recovery for intensive care patients. My research interests focus on recovery after intensive care, whether the patients ended up in intensive care as a result of illness or injury. What we're looking for is the things that cause a patient to have problems, and then how we can develop interventions to improve that recovery after intensive care. One of the projects that we're working on at the moment that is starting to see some benefit for our patients is we're interviewing patients who have been seriously injured and asking them to tell us about their recovery after that injury. So we interview them in hospital and then again at 1 and 3 months after hospital, and they're able to tell us about what goals are important to them through their recovery, but also about the challenges that they face during that recovery. This will lead on to us developing some interventions that address those challenges and goals that they've described to us. I guess the other thing that this research tells us is how different every patient's journey is and how much we have to individualise care. The future of my research I see as continuing to concentrate on trying to improve the recovery of intensive care patients and looking for ways that we can do that. One of the benefits of being at Griffith is we have a great opportunity within the multidisciplinary team. So we have lots of different schools within the health area, and so our work can draw on psychology, medicine, community-based practices, and help us to build those interventions and then test them in the future.